Good morning, good afternoon, or good evening, depending where you join from. My name is Fernanda Mercilato. I'm a nurse and a master student in health science at the University of Caxias do Sul, located in the south of Brazil. However, I would like to sincerely thank the World Nursing Congress organizing community for the opportunity to present my research remotely. It is a great honor to share the results of our study with healthcare professionals, researchers, and colleagues from around the world.
This work is titled The Use of Pesticides and the Development of Cancer in Farmers, a Scoping Review. This research is carried out in collaboration with Nilva Lúcia Rex Tedley and João Ignacio Pires Lucas. We will work and teach at the University of Caxias do Sul, and we share a common interest in environment health, occupational risks, and the rural workers' health. Pesticides are a chemical substance used to control pests and protect crops. However, their use is not selective, meaning that they affect not only harmful organisms but also beneficial species, the environment, and the most importantly, human health. Over the last decades, there has been a global increase of approximately 93% in the pesticide use. In Brazil, the increase has been even more alarming, reaching 109%. Brazil is currently the largest global consumer of pesticides since 2008 and continues to rank among the top exporters of agricultural produce. This intense use poses several health risks, especially for agricultural workers who are exposed directly to test substances in the field. Scientific literature has increasingly linked pesticide exposure to chronic diseases, most notably cancer, a public health concern with environment and occupational dimensions. These situations highlight the urgent need for preventive strategies, education, and strong public policies to protect those who feed our populations, the farmers. Our main objective was to analyze the relationship between pesticide exposure and the onset of cancer in farmers based on the review of the most relevant and up-to-date scientific literature. This was accomplished through a scoping review, a type of review particularly useful for mapping and the exide evidence, identifying knowledge gaps, and informing future research, policies, and health practice. This was a scoping review conducted according to the PRISMA. A review protocol was registered in the Open Science Framework platform on August 2022. We performed a structured and comprehensive search in three databases: Virtual Health Library, Scopus, and Science Direct. We use a combination of keywords based in the DECS descriptors, including pesticides or agrochemicals or agrotóxicos, and cancer and farmers or agricultores. The search was conducted in Portuguese and English, starting open access. Peer-reviewed studies published between 2012 and 2021. Now I will detail our eligibility criteria, which are critical for the scientific rigor of your study. We include articles that met the following criteria: original peer-reviewed research, applied studies published in full, published between 2012 and 2021, open access availability, written in English or Portuguese, addressed the relationship between pesticide use and the cancer incidence in farming population. We exclude the following: systematic reviews, editorials, and theoretical essays, experience reports, theses, dissertations, and government documents. Study focus in the no agriculture workers or animal cancer. Study addressing acute poison or no cancerous chronic effects. Studies with indirect exposure only, such as environmental contamination. These criteria ensure that we were focused exclusively on research that directly analyzed the impact of pesticide use on the development of cancer among agricultural workers. To ensure reliability, articles were evaluated independently by two reviewers, and disagreements were resolved by a third researcher. We also use Cohen-Kappa coefficient to assess inter-rater agreement, with satisfactory scores above 0.6. We initially identified 1,343 articles across the three databases. After filtering through titles, abstracts, and keywords using text mining tools with Parsifal and Origin data mining, we reduced the sample to 151 articles. Following full test reading and strict application of inclusion and exclusion criteria, 29 studies were included in our final synthesis, all of which presented statistical significant results relating pesticide exposure to cancer development in farmers. The select studies represent a broad group perspective. They came from 5 continents, with a strong concentration in countries where agriculture plays a major economic role. United States 9 studies, Brazil 8 studies, and France 4 studies. Where no studies found from Oceania indicate a regional gap in research. This global distribution reinforces the idea that pesticide-related cancer risks are a global concern, not limited to a specific country or region. Most of select studies were case control or cohort studies. Both consider high-quality observational designs for studying exposure-related diseases. The statistical methods we used were mostly inferential, including logistical regression, odds ratios, risk ratio, Cox proportional razor models, t-test, chi-square test, and correlations analysis. The methodologies vary widely, reflecting the complexity of studying environment of occupational risks. The studies identify a wide range of cancer associated with pesticide exposure. The most frequently observed types were lung cancer, hematological cancer, such as leukemia, lymphoma, and multiple myeloma, prostate cancer, breast cancer. Some studies also investigate liver cancer, brain tumors, stomach cancer, skin cancer, oral cancer. These findings show that pesticide exposure may affect multiple organ systems, especially where exposure is prolonged and repetitive. Many studies use biomarkers to investigate early signs of cellular and DNA damage. Biomarkers detected include oxidative stress indicators, chromosomal alterations, DNA methylation strains, shortened telomeres. These biological markers may be crucial in the early detection of cancer risks even before clinical symptoms appear. The identification of such changes reinforces the importance of occupational health monitoring, particularly in high-risk populations. The studies highlight several factors that increase cancer risk among farmers. 1. Prolonged exposure to highly toxic pesticides. 2. Male gender, due to rare occupational exposure. 3. Low or incorrect use of personal protective equipment. 4. Direct contact with pesticides during application or preparation. 5. Living in region with intense agricultural activity. 6. Smoke and genetic predisposition in some cases. These findings demonstrate that cancer development is multifactorial, involving both occupational and personal variables. Two longitudinal cohort studies deserve special mention. One agriculture health study, United States, demonstrated links between specific sites and lung cancer, multiple myeloma, and non-Hodgkin lymphoma. And two, agriculture cancer cohort, France, showed increased risks for prostate cancer and other neoplasms related to lifetime exposure in farming population. The large sample size and long-term follow-up make these studies highlight significant in the field of occupational health. The review clearly shows that occupational exposure to pesticides increase the risk of developing various types of cancer. It is important to highlight that most of included studies confirm this association with statistical significance. The lack of personal protective equipment, lack of education about the risks, and regulatory weaknesses in some countries contribute to the vulnerability of rural workers. This situation demands urgent action in multiple areas: public health policy, occupational surveillance, preventive education, and promotion of service farming practices. Based on the evidence gathering, we propose the following recommendation: strictly public policy to ensure the protection of agriculture workers, promote safe pesticide handling protocols and the mandatory use of personal protective equipment, encourage the transition to safer agricultural practices such as agroecology, implement educational and training programs for farmers and health professionals, enforce international standards to limit and ban the use of highly toxic pesticides, invest in biomarker-based surveillance systems for early diagnosing exposure populations, the engagement of government, academic institutions, civil society, and rural communities is essential to make these measures effective. In conclusion, pesticide exposure is strongly associated with increased cancer risk in farmers. The evidence supports the use of biomarkers for early detection. There is a critical need for education strategies and occupational health programs to prevent harm. The collaboration of health professionals, researchers, and the public authorities is fundamental to address these public health issues. Thank you all for your attention and interest in our research. I'd like to express my deep gratitude to the World Nursing Congress for allowing this remote participation. If you have any question or wish to discuss any aspect of this presentation, please feel free to contact me via email. I would be happy to respond kindly and respectfully. Warm greetings for Brazil.